Remember that anti-health reform activist in Florida? He was a doctor who mass emailed out this charming, racist anti-health reform flyer over the summer. Oh, it's so clever. See, the president is not just a witch doctor with a bone through his nose. The president is a commie witch doctor with a bone through his nose. Ah, the satire. Now, the activist who was caught sending around that email, Dr. David McCaleb, has a new anti-health reform strategy now. Now he is trying to lure liberals who are unhappy with the Senate health reform bill into working with him to kill the bill. In an email to progressives, McCaleb quotes former Vermont Governor Howard Dean, MSNBC's own Ed Schultz, and Salon.com's Glenn Greenwald criticizing the Senate bill. He then follows up with his own liberal call to action, saying, quote, "Last July, many of you emailed me to express your anger over an email I forwarded on that was offensive. I kept your email addresses because I identify with fighters like you. Please mobilize your forces and call your representative and senators in Congress. Tell them you will work to make sure they are unelected next time if they approve of this." You know, it is true that some liberals have joined conservatives in the Kill the Bill caucus. A lot of non-conservatives objecting to the Senate health bill on policy grounds, including now New York City Mayor Michael Bloomberg and New York Governor David Paterson, both of whom are saying the Senate bill would be bad for the state of New York. So with all the Republicans objecting on political grounds and conservatives objecting on ideological grounds and liberals objecting on policy grounds, the Kill the Bill caucus has become a pretty big tent. Not that big, though. Safe to assume there's no tent quite big enough to fit the racist witch doctor email guy inside it, huh? Joining us now is former Vermont Governor and DNC Chairman Howard Dean. Governor Dean, thank you so much for coming on the show. It's good to have you back.
Thanks for having me on.
Last week on this show, I have to confess to you, we included your floating disembodied head alongside the yellow jumpsuit Kill Bill caucus, people trying to kill health reform. We did that not out of disrespect, but because you were saying the Senate bill should be killed. You're no longer saying that. Why have you changed your feelings on that?
Well, there's two reasons in essence. The first is the bill was improved. What the president and the Congress has essentially done is to expand the existing system, not to reform the system. There are a lot of things that have been changed. There's some faults, which we talked about last week. In the intervening week, they tightened up the cost control. Money was added for community health centers for wellness and prevention. They increased doctor reimbursement to rural physicians. So they've done a number of things that will make this approach more likely to work. It also is going to a conference committee with a body that did vote for a public option. In my view, in order to have any reform, you've got to have a public option. You've got to give Americans a choice between different kinds of systems and not just require that we be in the system we already have. That may or may not happen in the House. The second thing is, honestly, to see the Republicans up there carrying on the way they are, I basically concluded that, that maybe we should just pass this thing. It's going to take an awful lot of time to work on it. But if the Republicans hate it, there must be some good in it.
In terms of the process, it seems like we are coming to the end of the Senate process. It seems like the bill is definitely going to pass in the Senate. It looks like it will pass at 8 a.m. On Thursday, on Christmas Eve. But then, as you say, it does go on to the conference committee. And a lot of people who are disappointed in this bill, who think that it got worse over time, are looking to that conference committee process to hopefully make the bill better. And then there has to be another vote. What's going to be your bottom line at that point? What do you need to see in terms of improvements before you'd support people voting for it?
I would like to see a public option. That I think is unlikely. Since that's unlikely, I would like them to fix. Most of the House bill I think is better than the Senate bill. For example, the so-called pre-existing condition, but you can charge 3 times as much as to an older customer as you can to a younger customer in the Senate bill for the insurance companies. In the House, it's twice as much. Well, in Vermont, it's 20% more, so a whole lot less. I'd like to see them lower that number really substantially to make the bill more affordable. Secondly, I'd like to see the biggest expansion Medicaid could possibly have using federal funds to do it, the way Ben Nelson cut the deal for Nebraska. That should be applied to all 50 states. When we went to universal health care for kids under 18 in my state 15 years years ago, we used Medicaid as the vehicle. You do have to increase reimbursement to physicians, but that would be significant help. So, you know, if this is the bill that's going to pass, and if we're going to have these fights for the next 30 years with insurance companies, you might as well give us a head start.
Senator Tom Harkin of Iowa said this week that in his mind the public option is not totally dead. He says he plans to revisit the idea of the public option in the near future. If this bill passes, does it actually provide an appropriate foundation for a public option to be introduced as a separate matter after it passes?
Actually, it does. You could lower. The Senate's idea originally was actually better than the House's. The so-called Medicare compromise. If you were allowed in the public option, there'll be something called an exchange. That's where you're going to go to buy your health insurance. All you got to do is put in that exchange a public option. There isn't one now. It's some kind of nonprofit hocus pocus that's run by the private sector and governed by the Office of Personnel Management. You could, if you gave people the choice of enrolling in Medicare if they're under 65, or gave them the choice of another public option, I think Medicare is a much smarter way to go, because you already have the bureaucracy all set up and ready to go. They already do 1 billion claims a year. You could put that choice into the exchanges. Once you've got the exchanges set up, which is something that also came out very well in the Senate, and in the House, actually, the exchanges came out well. A little stronger in the Senate now. So you could modify this. Tom Harkin's right. You could modify this at a later date. I wish that weren't necessary. I wish we had that change now, but you could do it later if this doesn't work out. And I think this 30-year battle with the insurance companies over regulation is going to be tough to make work properly.
Former Vermont Governor and DNC Chairman Howard Dean, thanks very much for joining us tonight, sir. It's always good to have you on the show.
Thank you.